All right, we are here with Matt and Jess, and they're going to introduce themselves and tell us where in the world they live and how they first learned about congenital diaphragmatic hernia.
Okay.
Okay.
Hmm.
Well, yeah, we're Matt and Jess. We live near London in England. We have twin boys who are just turned one. One of them we found out at about 16 weeks had CDH. I think obviously hadn't heard of hadn't heard of it before. It was just that sort of sinking feeling after we'd gone in for quite regular scans, and it was about 16-week scans, something like that. And you know there's something wrong when the, uh, the girl doing the ultrasound sort of stops and zooms in on something and then disappears to speak to a consultant who comes back in, and they all look very somber and worried. And then after the scan, they sat us in this little room with a little printout piece of paper, trying to explain exactly what the CDH was and what the effects are. In fact, they Hugo is our son with the CDH, and we've got Theo as well. And Theo didn't have any signs that there was any issues there. It was just Hugo. He They spoke to us in pretty grave terms. You know, they were talking about potentially terminating the pregnancy, and
They gave him 50-50. They said it's 50-50 survival.
50-50 survival rates and things like that. Um, which is obviously pretty devastating. I mean, we'd been trying for a baby for quite a while, and we'd managed to get pregnant on the third go of IVF, and obviously our hopes for a child were riding on this, and to be told that that he probably won't survive, and that termination might be the best thing for for us and for the baby was devastating. You know, I remember I had to go to work and was crying on the tube, and got to the office, and everyone knew that Jess was pregnant, and they sort of said, "Oh, how's the scan?" Because you just think it's just going to be a standard sort of checkup or whatever. And I burst into tears and had to go home. So it was very upsetting, and it was the same for you as well,
Oh
wasn't it?
yeah,
It was,
absolutely, yeah.
same thing. You kind of feel like your whole world has crumbled. That you've gone from being so overjoyed about being pregnant, about the prospect of having twins, how exciting all of that is, and then to be told that there's a good chance that you won't end up with these babies was very upsetting.
Because being a twin pregnancy, if something did happen to Hugo whilst I was still pregnant, it could then obviously it could have affected Theo too. So
They're identical
they're
twins,
identical.
so they shared a placenta,
Wow.
and you know, the whole pregnancy was extremely complicated because we had other complications because the fact that they were identical twins. We had twin-to-twin transfer and taps and things like that. But the big issue and the big uncertainty was with the CDH, because whilst they can monitor the other issues with the twin pregnancy, that actually you don't know what the outcome is going to be until they're actually born. So it felt like you're 3.5 months into what's supposed to be a 9-month pregnancy, and you've got 5.5 months of waiting, uncertainty, hoping that he grows sufficiently in the womb, that his lungs develop to a stage that because that we were always told that the biggest issue they have is that the lungs don't develop properly, and therefore no matter how much assistance they get when they're born, that they'll just never be able to survive off ventilation. And so that was the thing that we were obviously most concerned about. And obviously being identical twins, they're naturally smaller anyway, and the likelihood was that they weren't going to make term either, because of various potential issues and things like that. And in the end, they were born by C-section at 33 weeks. But I think it's, in many ways, we were very lucky because we had a lot of support from the hospital. The hospital we were at, which is called St George's, is up in London, and it's our local hospital, and it deals a lot with a lot of CDH babies, and obviously being diagnosed during the pregnancy, it meant that they were prepared for us. There were, we had 18 people in the C-section surgery room, and they immediately whipped Hugo out, put him on ventilation, and he was in the best place to get the treatment that he needed. The hospital were excellent, like reassuring and skilled at what they do. And I think actually they told us just prior to having the C-section that actually their survival rate for CDH is actually a bit higher. It's more like 60 to 70%, and I think it's because that they have, especially when they're aware that it's coming, that they're able to prepare much better than perhaps a lot. Often I don't think it is diagnosed prior to the birth, and therefore the doctors are scrambling around to try and work out what the problems are and things like that. So I think we were, in a way, we were very lucky with where we were based and the treatment that we received.
I think, but finding when he was diagnosed with the CDH when I was pregnant, it was obviously the first. I'd never heard of anything like this before, and it wasn't something I'd expected. There were things I would expect could happen in pregnancy, but I never expected that. And they were very good at informing us about it, and there were things to look at. But you almost can't then enjoy your pregnancy. You're sort of just in limbo of whether you're actually going to end up having a baby at the end of it, or how they're going to survive. And then because we did know that there was the issue, and the C-section was very well planned, that was brilliant. But then you've still got the uncertainty of how they're going to do once they are born. And actually, he's a year now, but he's had a lot of other complications from the CDH as well that I think I was never aware of.
But I think one of the problems is that when you have a medical issue that you don't know anything about and don't understand, you immediately go and look on Google, and actually that almost made the pregnancy worse, because obviously we found cherubs and read all the stories, and it's obviously great for the support, but obviously you can see how many babies don't survive with this issue, and it's you end up inevitably looking at it in the most negative terms, and waiting months and months before you find out what the actual extent or the prognosis or anything like that is. It's a long 5 months, a long 5 or 6 months. So it's no one I've spoken to has ever heard of CDH, and it's really, given that it's 1 in 2,500 babies, you'd have thought that there'd be a lot more literature and awareness of this. I think it's something that my sister and my mother both work, both nurses, and neither of them had ever heard of CDH. It's not, just isn't a commonly known issue, and it's obviously so devastating. With Hugo, after obviously when he was born, they were both about 4 pounds, but we were lucky in that their lungs had developed reasonably well. And obviously when he was taken away to be put on the ventilation and into the ICU unit, he actually responded very well and was very stable. So that was what they were looking for, was obviously to try and keep him as stable as possible. And 4 days after he was born, he had the operation to repair what they described as quite a large hernia, but luckily didn't need a patch. But there were, I've forgotten exactly how much was in there, but it was
Stomach, spleen, bit of the liver, and
intestines.
stomach. Yeah.
Yeah, so there was it was quite a sizable issue, and obviously his left lung was I believe about half the size.
Yeah.
And given that they were so small anyway, it was a tiny little um, uh, yeah, it was a tiny lung anyway. So yeah, it was very worrying at the time. But
Yeah.
we were very lucky. He responded really well to all the to the surgery, to the one of them's awake, to the surgery and to the ventilation, and he was taken off. He was yeah, he was out of ICU what,
2 weeks.
2 weeks after he was born, and spent 7 weeks in total in hospital. So actually, do you want to go? Sorry, one of them is crying. Do you want to go and deal with him?
Okay.
Yeah. Okay.
We don't, I mean, it's fine, whatever you want to do. I mean, the noise isn't going to bother us, but I mean, obviously, if he needs her. Aw.
Really, because it's such an exciting. It's meant to be such an exciting time, and then to have to go through all of this.
Wow.
In the other room, maybe it's a bit better. But okay, shall we carry on? I can't remember where we got to now.
Yeah.
Sorry.
I think we just
No,
said
it's
that
Hugo.
I think we said that Hugo had been was out. He was out after 7 weeks.
Mm-hmm.
You're moving it around. Sorry. Here we go. Let's see again. Yeah. So Hugo was released from hospital after 7 weeks, and his brother had come out 3 weeks before.
Yes, 3 weeks. Yes.
3 weeks before. So effectively, Hugo was out by the time he would have been term. So we were very lucky that he came out so quickly. But he really struggled with reflux. So obviously, he had to have. I started on ranitidine and then onto omeprazole, and to try and keep his fees down. He struggled a lot with vomiting. Didn't put on any weight.
Yeah.
Remained very small. And then they were born in March. Then in September the first time he went to hospital.
Yes. Yes. Oh, yeah.
So he went into hospital in September was that the bronchiolitis?
No, that was the bowel obstruction.
Oh yeah, he went in. We had an issue where he was. Well, actually, ever since he was born, he had times where he would get constipated, and his bowels wouldn't work properly. So we had to do things like laxatives and things like that. And in September, he hadn't had a poo for a while and was vomiting a lot, was really uncomfortable and squirming. So we took him to the hospital where they diagnosed that he actually had a blockage in his bowel. They think it was from the scar tissue from the CDH repair had gone into his bowel and had caused an obstruction. So he had to have another surgery to effectively take the bowel out, check it, remove the scar tissue, make sure there were no other problems, and then and put it all back in. So he was in for a week.
Yeah, about a week.
About a week with that, which again was another slightly stressful time. He's been in how many times?
A further about 3 times. So then after that, it was much more to do with his lungs. So lots of bronchiolitis. He's had that.
He had pneumonia a couple of weeks ago. So he had a short stay for that.
So anytime he gets ill, he gets really ill and really, really ill quite quickly. So he's often has to be admitted, which is quite it's sad because then he loses a lot of weight. It kind of puts his development back.
That's always been the hardest bit, is the fact that he doesn't put on weight. When we take the boys out, they're looking at, oh, how old are they? Like 3 months, 4 months. You're like, well, he's a year, because he looks a bit like a funny old man because he's got a tiny little head and like quite a gummy smile, but he's just all skin and bone. There's no weight to him, and every time he starts putting on a bit of weight, he gets ill again and loses it all, and he starts looking less and less like his brother, who is much more normal, baby shaped. But he's such a an amazing little boy. Like he doesn't let anything get him down, and he's always smiley and happy. But you know, it's difficult because he's not even close to crawling or anything like that. He's got a curvature in his spine as well, which we're going to Great Ormond Street next week to get looked at. It's got to be looked at by a specialist, like an infant specialist. So, you know, there seems to be like a continual fallout from the CDH. It's not all done and dusted once the repair is made and they're out of hospital. There's always seems to be more and more issues and problems, and it's difficult, isn't it?
Yeah, really difficult.
You know, no one likes to see their children in pain or uncomfortable or in hospital or anything like that. But you know, he spent more time in hospital than either of us have in our whole lifetimes, and he's only a year old. So it's yeah, you know, it's very difficult, and it's also it's you know, people are very supportive of it, but they don't understand what the problem is. I think it's, you know, it's difficult, isn't it?
Yeah.
I'm sorry. It is. He sounds like quite a miracle to have, well, both the boys to have gone through a pregnancy like that. Um, uh, where we're editing the tape, the audience is they don't know a lot of the pregnancy stuff because where we stopped and we started, that that you know, there was also twin to twin transfusion issues and the loss of a third baby and CDH and uh,
It was
a
a very
host.
invasive pregnancy, I think, because I mean, as I said to you before, you know, Jess had to have two lots of laser treatment on the non-viable triplet, as well as the amniocentesis, where they test the amniotic fluid. Obviously, they had to do two of those because one on each baby. You know, it was very stressful, and it you know, every day we look at, you know, you look at the boys and you think how lucky we are to have them, and actually, you know, regardless of the problems that Hugo's got, he's such a happy, you know, he is a bit like he's a miracle, you know.
Yeah, absolutely.
He's such a happy, smiley little thing. I work away quite a bit, and I came back this evening, and I walked in, and immediately he looked at me, and his face lit up, and he starts waving and smiling, and you're just like, oh, it's all worth it. And you know, he's got the scar on the left side of his stomach, but it's such, you know, you can see it less and less every day. I think when he's older, you won't even notice it at all. You know, it's amazing. It is. He's just amazing.
Yeah.
But you do
Wow.
worry about him all the time. Every time he's, you know, if he doesn't eat for one reason, or if he's not hungry or something, you think, oh, is there another problem? Or, you know, if he has a vomit, you kind of think, oh no, is there another issue there? Um, but yeah,
Yeah.
That's
You're.
that's the normal first couple years for a
yeah,
CDH baby, unfortunately.
no,
Um, but he sounds like an absolute fighter, and 4 pounds at birth, no less, and still, you know,
mm.
and eating by mouth. And so, right? Is he, or did
Yeah,
he is?
yeah, yeah, yeah,
Yeah.
yeah.
That's great.
He's
Um,
he never had any oral aversions, which I was quite pleased about. He
wow.
was quite happy. He was up, you know, quite. The weaning was quite easy.
Wow.
He does still vomit quite a bit with the reflux, but likes food, which I was pleased about because
Hmm.
you do lots of reading and think, oh well, they're going to have issues. But actually, that was one thing he didn't seem to have a problem with at all.
He does have to have a special formula milk. It's a high calorie formula milk to try and help him put on weight. Although he never, as I say, it's all skin and bone. You look at him, you can, you know, there. Yeah, there's nothing. There's literally nothing to him, and you know, when he's ill, you can see his chest all sort of sucks in, and you know, he's he is small and he's weak, and he, you know, he can't crawl and things like that. But he you know, he's getting stronger every day, I think.
Oh, well, I'm in London fairly often for work, so I will have to try to meet you
Yeah,
That'd be
and the
lovely.
yeah,
boys.
absolutely.
I would
Yeah,
love
yeah,
that. I would
Yeah,
love
it'd be
yeah,
great.
that.
definitely.
Yeah,
You have to let us know.
absolutely, absolutely. It's so lovely to meet you both, and
Thank you.
thank you
Nice
for
meeting you.
sharing your story.
Sorry I
It's
had to go
quite,
off.
no, it's okay. You have two children. We understand that. We're a children's charity. We understand that. That's no problem. Um, but you're amazing, to go through all that you've done to have these boys, and to go through CDH. And I hope for you that once all the CDH stuff settles down, that you have a quiet, uneventful, quite normal
Yeah.
Yeah.
childhood, for the boys, and so that
It's
you
all
can
it's all worth
relax and
it. It's all
enjoy.
worth
Yeah.
it though, regardless. I think we're so blessed to have the boys, and even with Hugo CDH, I think you almost wouldn't change it because you'd end up with a different child, and we're very lucky to have them both. And Hugo's our special little one, but his bigger younger brother is
Mhm.
also brilliant.
Yeah.
Yes.
But
Yes.
yeah,
Oh,
thank you, Dawn.
thank
It's
you
been very
both.
nice to chat to you. Thank you.
Yes, you too. And I look forward to getting to know you better. And
Yeah, definitely.
and as you know, Cherubs is here. Whatever you need, frustration with putting on weight, we all understand that
Yeah,
at
Yeah.
Cherubs. Or, like I said, when we were on break, we have quite a few twins in the group, and identical and fraternal. So, we're more than happy to, set you guys up with some of those families too, so you can have an idea long term what they went through.
Yeah,
And
yeah, brilliant.
okay, great, we'll do that. And thank you, and I look forward to talking to you again soon.
You
thank you
All
too.
very much.
right,
Thank
Thank you,
you.
Dawn.
thank
Thank
you.
you.
All right,
Bye
bye bye.
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 Hi, April 19th is International Congenital Diaphragmatic Hernia Awareness Day. CDH takes 1,000 of our kids every year, and we're trying to raise awareness. Go to www.cdhi.org. I'm praying for all the families affected with CDH. Please help us in our efforts. Lots of love.
Dr. Drew here, and I'll remind you that April 19th is Congenital Diaphragmatic Hernia Awareness Day. This affects thousands of kids every year. People are unaware of this condition. It's relatively common, and sadly, the survival rate is just at around 50%. Telethon is coming. You can find out about that telethon at cdhi.org/2019 CDH Telethon. Again, cdhi.org/2019 CDH Telethon. And a reminder, today is CDH Awareness Day. Donate to help the kids. I'm Dr. Drew.